Have you ever wondered whether a private habit you keep secret could already be shaping your body, confidence, and sexual peace today? And if it feels harmless in the moment, why do so many adult men still fear it may be weakening them over time? I have spent years hearing these questions in quiet clinical conversations. Today, I will explain this clearly and without judgment, because it matters. I will show you what is normal, what is myth, and what deserves attention. Some fears are false. Some signals are not. Stay with me, because near the end I will share one 10-second tip for judging this habit calmly. Welcome, and thank you for being here. This private subject deserves a clear, medically honest, and respectful answer. Let us remove the fog. Many adult men were never given a serious explanation of masturbation. They were given jokes, warnings, guilt, or silence instead. That silence can follow a man for decades, especially after 50, when private changes feel heavier. A man may wonder whether masturbation drains hormones, weakens erections, harms the prostate, reduces stamina, or signals hidden damage. He may notice changes in desire, orgasm, or recovery and blame the habit first. But stress, poor sleep, medication, blood pressure, anxiety, and aging often matter more than he realizes. That is where confusion begins. Modern sexual health guidance is calmer than many men expect today. Masturbation is generally considered normal and is not known to lower testosterone long-term. Healthy adults are not thought to be physically harmed by it alone. What matters is comfort, control, context, and whether pain, injury, distress, or abnormal symptoms are appearing. This is the clinical balance. This is not a moral lecture, and it is not careless reassurance. It is a conversation, and it works best when fear and fantasy are kept in check. For some men, masturbation remains a normal part of adult sexual life without creating problems. In some adults, it may offer safe sexual release and self-understanding, but the pattern still matters. If the habit brings irritation, pain, loss of control, or distress, it deserves a closer look. The same is true if a man becomes dependent on one narrow kind of stimulation. What matters is what happens in his body, mind, and daily life around that habit. Age can make that question feel heavier. Many men over 50 were raised where sexual concerns were hidden, mocked, or reduced to myths. Sexual health in older adults is overlooked, even though desire, intimacy, confidence, and function matter later. So when erections change or recovery slows, many men blame themselves before asking a doctor. That becomes lonely fast. The truth is more useful than shame. Masturbation does not automatically mean damage, and it does not prove weakness. It does not, by itself, explain every erection problem or every change in sexual confidence. But some signs should never be brushed aside simply because a man feels embarrassed to ask. Please hear that clearly. Pain with ejaculation deserves attention, and repeated blood in semen does too. Major changes in ejaculation, genital sores or lumps, severe curvature, or persistent erection problems also deserve proper medical evaluation rather than private guessing. Recurrent distress or loss of control can deserve support because compulsive behavior can affect mood, relationships, concentration, and daily life. Embarrassment delays care, and delayed care can hide treatable causes. Those causes may include medication effects, pelvic or prostate irritation, vascular issues, anxiety, depression, or broader health problems. Sometimes the habit becomes the scapegoat simply because it is private, and blaming it feels easier than facing a real medical question. That is why this matters now. If you are an older man, the timing matters even more. Sexual changes later in life can be connected to blood flow, heart health, hormones, medication, sleep, mood, relationship strain, or chronic disease. Persistent erection problems should not automatically be blamed on masturbation, because erectile dysfunction can also be an early warning sign of cardiovascular disease. That changes the conversation. In this video, I will separate old myth from current medical thinking. I will explain where masturbation may be neutral, normal, or helpful. I will show where habits become unhealthy and which signs mean it is time to get checked. I will also give you a simple framework for judging frequency, comfort, control, and context without shame. So stay with me and let us examine this honestly, calmly, and like adults for once. By the end, you will know what deserves peace of mind, what deserves caution, and what deserves a doctor. Most adults were never taught to think about masturbation in a medical way. They were taught to laugh about it, hide it, or judge it. That leaves many men with two bad choices. One is guilt. The other is careless habit. Neither helps the body. A more useful view is simpler. Masturbation is not a miracle treatment, and it is not automatically a problem. It is a body practice. Like many body practices, its effect depends on how often it happens, how it is done, what state your mind is in, and whether your body is giving you any warning signs. When it is approached with maturity, it may support a few parts of adult well-being in a very ordinary way. The first is tension release. Sexual arousal raises muscle tension, breathing changes, and nervous system activation, and orgasm can bring a short period of release afterward. For some men, that creates a brief drop in mental pressure, a softer stress response, and an easier transition out of built-up physical agitation. That does not mean it fixes anxiety. It does not cure loneliness. It does not solve depression. But for some adults, it can reduce a layer of tension that was sitting in the body all day. That matters, especially for men who carry stress in the jaw, shoulders, belly, and pelvic area without noticing it. There is also a body awareness benefit that people often underestimate. A man who pays calm attention to arousal, erection quality, sensitivity, and recovery may notice changes earlier than a man who never checks in with his own body. He may notice new pain, weaker erections, unusual curvature, loss of sensation, trouble with orgasm, or irritation of the skin sooner. That is not vanity. That is observation. There is one more practical benefit in that same lane. Sexual response sometimes reflects general health sooner than people expect. Changes in erection quality, sensation, orgasm, timing, or recovery may be influenced by stress, poor sleep, diabetes, vascular disease, medication effects, alcohol, or mood. Masturbation does not diagnose those problems, but it may help a man notice that something has shifted. That observation is useful when it leads to a better conversation with a clinician instead of denial. In that sense, solo sexual activity can become a form of body literacy. It can teach what feels normal, what feels different, and what seems to be changing over time. For adult men, especially as the years pass, that kind of noticing can be useful. Sexual health is still health. It is not separate from circulation, nerves, hormones, mood, sleep, medication effects, or chronic disease. How many adult men have been carrying fear and shame for years when what they really needed was one clear medical truth? If that gave you your first real value today, comment balance right now and let that one word remind you for the long run that sexual health is strongest when it stays calm, informed, and under your control. So the first useful shift is this. Stop thinking of masturbation as a moral label. Start thinking of it as information. When it is occasional, comfortable, private, and not driving the day, it may simply be one way the body releases sexual tension and reveals how it is functioning. That calmer frame matters before we go any further. The next point is often missed because people focus only on orgasm. The real value may begin earlier than that. During arousal, a man is noticing pace, sensitivity, breathing, fantasy patterns, pelvic tension, and how quickly the body climbs into urgency. That can teach something important. It can show whether your body responds best to calm, patience, and gradual stimulation, or whether it has been trained to expect speed, pressure, and overload. That matters more than many men realize. A rushed pattern can train the nervous system toward urgency. A steadier pattern can support better awareness of arousal levels and a little more control over when stimulation rises and when it pauses. That does not make someone a sexual athlete. It simply means the brain and body can learn habits, and habits shape response. For some adults, this becomes useful in partnered life. If a man understands what pace feels comfortable, what kind of touch causes irritation, and when he tends to lose control, he may communicate more clearly and feel less anxious. Sexual confidence is not only about performance, sometimes it is about knowing your body well enough to stop guessing. It can also reduce guesswork. A man who knows what kind of touch feels comfortable is less likely to chase pain, copy unrealistic habits, or assume that discomfort is just part of being male. Clearer self-knowledge often makes choices easier. There can also be a short-term sleep effect for some people. After orgasm, some men feel their body downshift, their breathing soften, and their racing thoughts quiet for a period. Many people report using masturbation to relax and fall asleep, and sexual health educators commonly describe that as one possible benefit. Again, the word is possible. It is not guaranteed. It depends on the person, the timing, and the surrounding mental state. Another reasonable benefit is safer sexual expression. Solo sexual activity does not create pregnancy risk, and by itself, it does not spread sexually transmitted infections. That does not mean every related behavior is risk-free, especially if toys are shared or hygiene is poor. But in broad terms, masturbation can be a safer outlet for sexual expression than choices that carry infection, risk, pressure, secrecy, or impulsive regret. There is also something emotionally healthy in replacing myth with reality. Many adult men still carry old fear that masturbation weakens the body, ruins masculinity, or permanently damages sexual function. Those claims are not supported in the way many were taught. Shame can become more harmful than the behavior itself. Shame makes men hide symptoms, avoid questions, and let confusion grow in silence. A more mature standard is better. Ask whether the habit leaves you feeling physically comfortable, mentally clear, and in control of your choices. If the answer is yes, that is very different from a pattern that leaves you sore, distracted, guilty, exhausted, or emotionally flat. The body often tells the truth earlier than the mind does. That is why the second shift is not about frequency alone. It is about quality. Is the behavior calm or frantic? Is it informed or mindless? Is it part of adult self-awareness? Or is it becoming a reflex that overrides judgment? Those questions matter because now we have to turn the coin. This is where many conversations become more trustworthy. A practice can have reasonable benefits and still become harmful when the style, context, or motive changes. That is true for food, exercise, work, and it is true here. The problem is not that masturbation exists. The problem begins when a man stops watching how he is doing it and what role it is starting to play in his life. One common issue is friction injury. If stimulation is too rough, too dry, too repetitive, or too forceful, the skin and underlying tissues may get irritated. Lubrication can help reduce friction, and that matters because small irritation repeated over time is still irritation. Some men ignore redness, tenderness, swelling, or a burning sensation because they feel embarrassed. That is a mistake. Pain is not a sign of toughness. It is a signal. Another issue is mechanical strain. Vigorous bending or forceful pressure on an erect penis can injure tissue. Healthcare sources note that painful ligament strain and even more serious injury can occur when an erect penis is bent forcefully. Most men do not think that applies to them. But injury does not always arrive dramatically. Sometimes it begins with a painful spot, a new ache, or a change in shape that slowly becomes harder to dismiss. That is why new curvature matters. So does pain during erection. So does pain with ejaculation. If semen contains blood, if urination burns, if the stream sprays strangely, or if the penis suddenly feels structurally different, that deserves medical attention rather than silent guessing. Embarrassment delays care. Delay can turn a treatable issue into a longer problem. There is a second layer. The nervous system can adapt to patterns that are too narrow. If a man always uses the same speed, same grip, same posture, same visual stimulus, and the same rushed path to orgasm, he may teach his body to expect a very specific kind of input. Then real-life intimacy may feel slower, softer, or less stimulating by comparison. This is one reason desensitizing habits can quietly interfere with partnered sex. That does not mean solo sex ruins relationships. It means conditioning matters. The body learns repetition. If you repeatedly train for intensity without variation, patience, or connection, the gap between private stimulation and shared intimacy can widen. A man may then blame age, his partner, or low testosterone when the pattern is partly behavioral. There is also the emotional trap of using masturbation only as escape. A healthy behavior becomes less healthy when it is the only answer to boredom, sadness, anger, loneliness, or stress. Relief is not the same as repair. If every difficult feeling gets converted into stimulation, the man may feel temporary release but learn less about his actual need. He may need rest, conversation, grief support, exercise, treatment for depression, or simple human closeness. That does not make him weak. It makes him human. But it does mean the habit should never become the main bridge between discomfort and relief. When that happens, the behavior is no longer just sexual. It is becoming emotional anesthesia. So the third shift is a respectful one. Ask not only what the habit gives you, but also what it may be helping you avoid. That question opens the final and most practical part of this discussion. Now we come to the strongest part. Health is not decided by one orgasm or one guilty thought. It is shaped by patterns. The biggest risk is usually not masturbation itself. It is a cluster of habits around it. Compulsive timing, excessive friction, digital overstimulation, poor posture, sleep disruption, and using the behavior to replace rather than support real life. Compulsive patterns deserve special attention. When sexual thoughts or behavior feel hard to control and start causing distress or problems at work, in relationships, in daily functioning, or in mental health, clinicians treat that seriously. The concern is not moral failure. The concern is loss of control. If the habit is repeatedly hijacking your attention, draining time, interfering with sleep, or pushing you into secrecy you dislike, that is a health issue. Posture matters too. Many men do not notice how often this behavior happens in a cramped chair, with the lower back rounded, neck bent forward, belly tightened, and pelvic muscles braced. Then they wonder why they feel oddly sore afterward. The body keeps score. A habit linked to tension can train more tension. That is one reason some men feel pelvic heaviness, low back discomfort, or a tired, strained feeling after a session that was supposed to feel relieving. Recovery matters as well. If masturbation leaves you briefly relaxed, that can be ordinary. If it leaves you depleted, numb, irritated, unable to focus, or strangely disconnected, pay attention. Those are not always signs of damage, but they are signs that the current pattern is not serving you well. Any habit that repeatedly leaves you worse deserves review. Porn-driven overstimulation can deepen that problem. Very intense, fast-changing digital content can narrow attention, raise novelty demands, and pull arousal away from ordinary touch and ordinary closeness. Not every viewer develops trouble, but some do. When arousal becomes tied mainly to endless novelty, ordinary intimacy can feel underpowered. The answer is not panic. The answer is to notice whether your private habits are making real-life connection easier or harder. This is where moderation becomes practical instead of vague. Leave space between sessions when your body seems irritated. Use lubrication if dryness or friction has become part of the pattern. Change grip, pace, and posture enough to avoid narrow conditioning. Do not continue through pain. Do not force an erection to bend. Do not ignore repeated soreness, blood, burning, or new curvature. And do not let the behavior become your only stress management tool. Here is the 10-second tip I want you to remember. Before you begin, pause and run this quick check. Skin, tension, motive. Is the skin comfortable? Is the body relaxed? And is the motive desire rather than escape? If any one of those is off, stop, reset, or choose a different form of care first. That tiny pause can prevent a surprising number of bad decisions. And keep one last standard in mind. A mature sexual habit should fit inside a healthy life, not replace one. If it protects comfort, control, and self-respect, it may be serving you. If it is crowding out sleep, relationships, movement, work, emotional honesty, or medical attention, it is asking too much of the role. That is the strongest correction of all. Do not judge yourself harshly, but do not hand the habit more power than it deserves. Use it with awareness, protect the tissue, respect the warning signs, and keep the rest of your health in the picture. So let us bring this down to a few clear principles. Masturbation is not a dirty secret, and it is not a magic solution. It is one part of adult sexual health. When it is moderate, comfortable, and under your control, it may simply be a normal outlet and a useful source of body awareness. When it becomes rough, compulsive, emotionally avoidant, or physically painful, it stops being a simple outlet and starts asking for correction. That gives you a practical framework. Protect the skin. Respect posture. Avoid training the body to need only one extreme pattern. Pay attention to soreness, curvature, burning, blood, or repeated pain with ejaculation. And never let private sexual behavior become your only way to handle stress, emptiness, or loneliness. This is not about fear, it is about standards. Small standards protect function. Small standards protect dignity. Small standards also make it easier to notice when your body needs medical help instead of silence. And if you have felt shame while listening to this, set some of that weight down. Adult sexual health is still health. Caring about it is not childish. Asking questions about it is not weak. Noticing changes in your body is not something to hide. It is a sign that you respect yourself enough to pay attention. If this helped you think about the topic in a calmer and wiser way, share it with another adult man who may need the same relief and clarity. Subscribe if you want more doctor-led guidance in plain language. And comment with the word balance if that is the standard you want to remember. Thank you for staying with me through a subject many people avoid. Your body deserves maturity, not mockery. Your sexual health deserves attention, not shame. Take care of yourself, notice what your body is telling you, and I will see you in the next video. If symptoms keep returning, do not self-diagnose for months. See a doctor or urologist. Early questions are easier than delayed regret, and straightforward care often brings more real relief than secrecy.